A lot of patients are concerned about, am I going to feel pain during the surgery? And I usually try and tell patients that it's normal to feel some discomfort sometimes. So in the initial parts of the surgery, we're really trying to communicate a lot with the patients and say, are you feeling this? Does this feel okay? Are you doing okay? And we're a little bit hyper about it in the first 30 minutes because once we know that someone's numb, they're numb, and we can do the surgery without taking too many pauses. If someone's starting to feel something, then we want to add some more numbing medication to make that area a little bit more comfortable. So I think for most patients, it's pretty easy to tell pretty early on when we start doing the initial pokes to get things numbed up. If they're really jumpy, then they're probably going to be jumpy throughout the whole surgery. Most patients are feeling pretty relaxed from the anxiety medication that we give beforehand, that they don't even feel the first few pokes, or if they do, they say it feels like a bug bite. So it's usually not this really jump off the table, painful experience. As the procedure goes on, we do want to make sure that we continue to maintain good control of your pain and your discomfort throughout the procedure. And we have about 8 out of 10 patients say at the end, that was way better than I thought it was going to be. 1 out of 10 patients says they don't feel pain at all throughout the whole procedure. And then there's probably 1 out of 10 that's like, yeah, I would do that again, but there were definitely some areas that kind of poked or zinged a little bit. So I think, knowing that 9 out of 10 patients are going to have a really good experience or better than they thought it was going to be, and 1 out of 10, well, maybe it's what they thought it was going to be, but they would also come back and do more, I think is really telling for what you can kind of expect. I'd say more often than not, the person that's the most stressed during the procedure is usually me, because I want to make sure that you're feeling comfortable as a patient. But at the same time, most patients afterwards, even if I thought that they were feeling like some pokes and zings, afterwards they were like, oh, that was great, it went really well, I would totally do it again. So again, I think I'm the one that's probably the most stressed about making sure that everyone's comfortable, and the patients overall seem to do very, very well, even if it seems like in the moment they're feeling some pokes.